Hey there, how you going? It's Dr. Moz here. Just thought I'd do a little video series covering some of the really common topics that we see in clinic all the time. Today we're going to cover the use of spacers and inhalers. There are a large variety of patients who are on some version of inhaler medicine. We use them all the time for people with things like asthma and emphysema. And sometimes occasionally we'll use them in short bursts after viral illnesses. And often when I ask you to use some version of an inhaler, I'll almost always ask you to use a spacer. So this video hopefully will cover some helpful tips for how to use a spacer. A spacer is a piece of equipment that's designed to help aerosolize the medicine and keep it in the air. And we often hear things from people like, I'm not a kid, we just use it when we were little, I know how to use my inhaler, and it's a free world, you can do anything you want to do. But when you don't use a spacer, roughly 80% of the medicine ends up stuck to the palate and only 20% makes it into the lungs. Whereas when you do use a spacer, that is reversed and about 80% of the medicine ends up in your lung with only 20% ending up on the palate. So number one, it helps deliver medicine effectively to your lungs. And number two, some of the medicines that we use with inhalers do have some side effects that can be controlled or minimized by the use of a spacer. So probably one of the most common medications that we prescribe to be used as an inhaler is some version of steroid. One of the most common risks with a steroid is developing mouth ulcers and mouth thrush, along with developing a hoarse voice. So these are all things that can happen if too much steroid lands on the palate, tongue, and vocal cords. So one of the ways to reduce that is to make sure that we're using a spacer, and really importantly, to rinse your mouth out when you're done with delivering the dose. So if you've never used a spacer before, it's probably really important that you get familiar with how to use one. You'll get a little spacer device, and I'll try and put some video overlays, but you'll get a little device that's made of plastic or cardboard, and there's usually a one-way valve. When you first buy it, it's probably important to check to make sure that there aren't any cracks or breaks in any of the plastic or the material. If you've just bought your spacer, then once you've assembled it, if it needs assembling, then it's probably important to give it what's called a priming dose, which is just actually give it 2 squirts of medicine into the inhaler, into the spacer, to coat the plastic. Because of static electricity often interfering, you actually need to make sure that you do squirt some medicine in there to line the inside of the plastic. Once you've done that for the first time, you'll grab your puffer and put the puffer into the side of the inhaler with some squared off edges, and that's the side that you know is for the inhaler, not for your mouth. And there'll usually be a little mouthpiece. Once you've connected it in, empty out your lungs, pop your lips gently around the mouthpiece, making sure that you've got a really good seal and trying your best not to use your tongue, your teeth. Once you've got a good seal around there, deliver a dose of medicine and just take nice, big, deep breaths for about 10 seconds or so. If you've been prescribed more than one puff, once the 10 seconds are up, just give another dose of inhaler and breathe deeply again for another 10 seconds or so. Those 20 seconds are 2 puffs. And when you're done, you can pull out the metered dose inhaler and rinse your mouth out and put away your spacer somewhere safe. A few things that are important. Firstly, check to make sure that the dose of inhaler that you're using is the correct dose. Check to make sure that the medication is indeed in date. Check to make sure that there is some medication. Some puffers have a little counter and some puffers don't. If your puffer doesn't have a little counter, it's important to give a little squirt into the air and just make sure that there is still some medicine sitting in through there. And if you're not sure about an inhaler that has a counter, it's probably worth just actually giving it a squirt. Sometimes those little counters can fail. The other thing that's probably worth doing is roughly about once a month, it's worth making sure that you give the spacer a clean with some dish soap and water and let it air dry. Once you've done that, it's probably important to prime it again, which means give it another 2 squirts of medicine to make sure you line the insides and stop the important dose from being absorbed with static electricity. Hopefully that covers most of the important things for spacer use. If you have any questions, it's probably worth having a chat with your doctor or myself the next time you're in. Let us know if there's anything else we haven't covered down below. Take care. Bye now.